I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about postpartum anemia. So when you leave the hospital, if your blood level is low, if you already were anemic, low blood level, low hemoglobin, or you bled more than average after having the baby, you may be anemic. And that can add to your recovery time, make you feel more weak, more tired, and you have to take some additional precautions. So generally speaking, your hemoglobin level, if it's normal, is around 12, 13, 14. More commonly in pregnancy, 11, 12. And then afterwards, we're real happy if you're 11. You're a little bit anemic if you're 10 or even in the 9s for hemoglobin, this number. And you won't have too many symptoms there, but taking your prenatal vitamin will help build it up. Eating some red meat, steak, hamburger, beef can help build it up. If your hemoglobin is lower than 9, then you're probably going to have some additional symptoms. And if it's lower than 7, then you may be offered a blood transfusion because the risks start to increase. Your symptoms are pretty dramatic. And if you get substantially lower than that, the absolute number depends on your weight, whether you're a smoker, your overall health, your age. So we don't have magic numbers, but you're really starting to get into a life-threatening circumstance if you're around 6 or 5 or lower. But again, it depends on where you were before. Bottom line is that if your provider sends you home and you are anemic, especially if you're under 9, you have to take some additional precautions, and I'm going to go over those a little bit. So you may be prescribed some iron. Prescription strength is usually elemental iron, which is better absorbed and doesn't constipate, but it's not often covered, can be quite expensive, so you may have to get over-the-counter iron pills, and you can take the over-counter, that's ferrous sulfate, up to 3 a day, but I recommend that you take a stool softener with it because it's constipating. Some of the prescriptions that I write my patients have elemental iron. They absorb a little better. They don't constipate. However, they can be quite pricey and are not always covered. Okay. If you happen to have a steak, hamburger, beef that day, you can skip the iron pill because you can only absorb so much iron, and you really absorb quite a bit from that choice of food. Although if you keep only eating that, it's not only expensive, but it'll constipate you substantially. So, but it's something to increase a little if you can. It's much more bioavailable coming from beef, for example, than eating spinach. You have to eat a lot of spinach to be able to match the bioavailability of from what comes from beef. So you come home with a new baby, you're not getting much sleep. You're going to be sleep deprived. You might get dizzy. You need to get some rest. But if your hemoglobin level is low, if you're anemic, then you may get dizzier faster, more often, and you also may have increased risks of falls. You have to be cautious. I would certainly avoid driving or going even on trips if you're significantly anemic, to avoid the risks of injury where you could potentially lose more blood. You also need to pay attention to how much you're bleeding because generally speaking, you will be bleeding when you get home, especially if you're not breastfeeding. Breastfeeding can decrease it, but either way you will. So if you're bleeding substantially or if it continues, you need to let your physician know. Watch for shortness of breath. Watch for your heart racing when you're sitting there at rest. Be careful if you're pretty anemic about going and taking a shower when you haven't eaten and drank anything. So when you wake up in the morning, you're a little dehydrated and your blood sugar's a little low. So if you haven't eaten and drank, then you go take a shower. The hot shower makes your blood vessels dilate. And if you're already anemic, it makes the blood pool in your legs and you can get dizzy and pass out in the shower. So I recommend, especially if you're anemic, but even if you're not, be careful about this, to try to get some food and drink before you take your shower, and make sure someone's around, available. If you feel that dizzy in the shower, just lay down and then call for help, okay? Also, if you are, let's say you're home, and again, the numbers aren't specific because I don't know your particular circumstance, but let's say you go home and your hemoglobin is 7.3. That's low enough that if you were just to jump up and run across the room, let's say for some emergency, you would probably pass out. So I'll give you an example. Had a patient whose hemoglobin was in the low sevens, and she let her dog out and noticed the dog was running across the yard, and there was a dog catcher or something. Because her dog was free, she got worried about her dog, ran out into the lawn and passed out right into the lawn. Also, I've had patients who during the summer had a baby. It was nice, hot and humid out, and they were a runner, and after having a baby they were excited to get back to running, but they were pretty anemic and went for a jog outside with a hemoglobin around 8, and they were found passed out on the side of the road, dehydrated, overheated. So you want to be careful about pushing the limits right afterwards, and it takes about a week to get your blood level up a point. So if your hemoglobin is supposed to be 12 and you come home and you're 8, then each week you'll go 8, 9, 10, 11, assuming you're not bleeding too heavily and you're having a good diet and taking your iron pills. So you'll notice symptoms. You'll notice out of breath and a little more heart racing with activity if you're below 9. So let's say you go home with 8, then in 1 week you'll start to have better symptoms. So be careful. Don't put yourself in dangerous circumstances. Be slow. Be careful about going up and down stairs when you might get dizzy and out of breath. Move slower, and then you can build your blood level up. And again, be cautious about how much more you're bleeding. If you come out, you go home pretty low, and you start bleeding heavier, we need to call back. You need to come in and be sure and contact your provider. Those are some general instructions. Before you leave, if you are anemic, you want to get specific instructions from your provider based upon your own risks. Do you have high blood pressure? Do you have diabetes? Are you overweight? What's your age? What are your additional risk factors that can compound those risks? And should you get a follow-up blood level? Different things. That's something that your provider is going to cover for you. This just gives you some general interventions, some general education and precautions. I hope you found it useful. Please leave your comments. Thank you.